recently has become a very popular request from sellers to do an outright purchase of the practice with the seller staying on to work back as an associate. Sellers like the idea of no longer having to take on the business side of the practice and the fact that they now will be able to enjoy the clinical side for the remainder of their career. They see it would give them the ability to cut down on the number of days they work and be able to take off more time. Here's some of the pros and cons of purchasing a practice with the seller staying on. This can be a great option for new buyers and one that may give comfort knowing the seller is staying on to help with the transition, mentorship, and helping them to better understand the business side of the practice. While having the seller stay on may sound great, it can also work against you. Patients may only want to see the seller, and because the staff have been with the seller for so many years, they look to the seller for direction and guidance, discounting the fact that you now own the practice and are the boss. Here are some of the things to consider, especially if the seller is staying on. Before you close and take over the practice, be sure that you set clear expectations. How many days do they expect to work and for how long? It's important that you establish when they will exit the practice for good and retire. This doesn't mean when the time comes for the seller to exit, they have to leave. If the time comes and you prefer they stay, you can always give them that option. Also, keep in mind that you are not obligated to keep the seller on. If you see that it's not working out, you always have the right as the owner to let them go. You will also want to establish the expected compensation for the seller, as well as what type of cases or procedures do they expect to see. So now that we've outlined and discussed the pros and cons of having the seller stay on, there's one more piece to this puzzle, which can determine whether or not the practice can handle the seller staying on. Find out in part 3B.